Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm covering part 2 of cystic fibrosis. If you haven't watched part 1 already, make sure you watch it. Part 1, I cover the pathophysiological process of cystic fibrosis, the clinical manifestations, the signs and symptoms, and the diagnostic test. So that is very important. Make sure you watch part 1. But now in part 2, and this is the last part of the series, guys, is going to be the therapeutic management. There is no cure for cystic fibrosis. There are treatment modalities. So therapeutic management, it's going to be antibiotic therapy, because remember how I talked about in the first video, when it comes to cystic fibrosis, the patient has all of these thick, tenacious mucus plugs that are not moving. And we know that bacteria, we know that pathogens love moist, dark environments. Wet environments, especially, it's not moving. It's a perfect medium of growth for bacteria. So antibiotics, because these patients are at extremely high risk of infection. Improve nutritional support. Remember, guys, one of the organs that are severely affected is going to be that patient's pancreas, right? And so those enzymes that are produced to break down the fats, it's really not happening. Remember, the amylase, the lipase, the patient's not getting it. So that's very important for nutrition. And the last one is going to be airway, respiratory clearance, respiratory management, because obviously, guys, if these patients airway is being clogged up by all these thick mucus plugs, it makes it harder for the patient to breathe. Respiratory is going to be a big problem. Matter of fact, respiratory takes place first before the others. That's what's most important, because who cares about their nutritional status or infection if the patient's not breathing? But those are our 3 major goals when it comes to management of cystic fibrosis. So let's start with the pulmonary management. Again, antibiotics. Airway clearance therapies, guys. The patient's going to be getting postural drainage, PEP, everything that we can do to help clear the airway and minimize that obstruction that's happening with the patient. Flutter mucus clearance device can be used. Active cycle of breathing technique. Take a look at what this says. This is a series of breathing techniques to help clear secretions, because at the end of the day, guys, that's the problem. They have all of this thick secretion all over their body that's clogging everything up, right? So we're going to try to clear it out. Forced expiration or huffing with the glottis partially closed. This helps move secretions from the small airways so that subsequent coughs, the coughs that come after that, can move the secretions forcefully from the large airways. What else? Patient can get bronchodilator medications to open up those bronchioles. Patient can get nebulized saline. Physical exercise. Physical exercise is something simple, but it helps expand those airways. Physical exercise is an important adjunct to daily airway clearance therapies. Pulmonary infections are treated as soon as they're recognized. In patients with cystic fibrosis, characteristic signs of pulmonary infection, you guys need to know these signs: fever, tachypnea, and chest pain may be absent. So you got to watch this patient much more closely. Aerosolized antibiotics, IV antibiotics, oxygen administration, all of these to help that patient to breathe better. Look at this nursing alert. Signs of pneumothorax are usually nonspecific and include, you need to know this, tachypnea, that difficulty breathing, tachycardia, that increased heart rate. Remember, heart rate is supposed to be 60 to 100. Dyspnea, excuse me, I told you tachypnea was difficulty breathing. Tachypnea is high respirations. I'm sorry, guys. Tachypnea is high respirations. Remember, your respirations are supposed to be 12 to 20. Some of your books say 22. That's fine, but that increased respirations lets us know that the patient's not getting adequate oxygen supply. Okay, so tachypnea, that's increased breathing. Tachycardia, increased heart rate. Dyspnea, that is your difficulty breathing. Pallor, well, what color is the patient supposed to be? That pink color that brings oxygen, right? But they're pale, that lets you know they're not getting enough oxygen that's being carried in the blood. Cyanosis, where they're turning blue from that severe lack of oxygen. Look at what this says: a subtle drop in oxygen saturation, which is measured by the pulse ox. Remember, we use that pulse ox, and we want their oximetry reading Preferably, we want it to be 98 to 100, but we'll accept anything 95 or higher. Look at what it says. A subtle drop in oxygen saturation measured by pulse oximetry may be an early sign of pneumothorax. So we're going to be looking at that O2 sat very closely and very often. Hemoptysis. So now the patient's got blood in their sputum. Hemoptysis indicates a potentially life-threatening event and needs to be treated when? Immediately, right now. That takes priority. Sometimes bleeding can be controlled with bed rest, IV antibiotics, replacement of acute blood loss, IV conjugated estrogens or vasopressin, and correction of any coagulation defects with vitamin K or fresh frozen plasma. But if that doesn't work, if hemoptysis persists despite these measures, look at what it says. If hemoptysis persists, the site of bleeding should be localized via bronchoscopy and cauterized or embolized. So they might just burn that area to shut it off, okay? Nasal polyps. Nasal polyps can develop in 2/3 of patients with cystic fibrosis, and it occurs due to chronic inflammation. Treatment of nasal polyps includes intranasal corticosteroids, because what do steroids do? Decrease inflammation. Decongestants, and mucolytics. When you see a word end in itic, it usually means to break down, right? Mucus, lytics, to break down those thick, tenacious mucus plugs. Saline irrigations. These are often prescribed to remove the thick nasal secretions and to treat chronic sinusitis that is associated with cystic fibrosis. Anti-inflammatory medications such as ibuprofen are becoming more important in the treatment of cystic fibrosis, but careful monitoring for adverse effects such as GI bleeding is, look at that word, guys, essential, as in very important, as in muy importante, right? Remember, NSAIDs increase gastritis. NSAIDs are very hard on the stomach and they can cause gastric ulcers, so we got to be careful. Let's look at the management of GI issues that cystic fibrosis cause. How do we manage those? The principal treatment for pancreatic insufficiency, remember I mentioned a lot actually in the first video, how, you know, the pancreas is being rendered basically useless because of all these thick mucus plugs. They're just plugging up the pancreas, not allowing the pancreas to do its job. The principal treatment for pancreatic insufficiency is replacement of pancreatic enzymes. These are administered, look at this, with meals and snacks to ensure digestive enzymes are mixed with food in the duodenum. So guess what? If the pancreas is not able to do its job, which is release those enzymes to break down the food, patient still needs it. So what are you going to do? You're going to teach the patient that every single time they have a meal or even a snack, they need the pancreatic enzymes with meals and snacks. I put a star next to that, you know it's important. Usually 1 to 5 capsules are administered with a meal and a smaller amount is taken with snacks because obviously meals are bigger than snacks. Capsules. The capsules can be swallowed whole or taken apart, and the contents, those are the enteric-coated beads sprinkled on a small amount of food to be taken at the beginning of the meal or within 30 minutes of eating. Let's stop right there because usually you can't open capsules, but when it comes to the medications for cystic fibrosis, you can, because inside of those capsules are what? The pancreatic enzymes that's going to break the food down for the patient. So you're going to teach them that they need to take it with their meals or within 30 minutes of eating the meal, okay? The enteric-coated beads should not, the beads themselves should not be chewed or crushed because destroying the enteric coating can lead to inactivation of the enzymes and excoriation of the oral mucosa. Yeah, remember, those beads or enzymes, they're supposed to break down the food, but they're going to break down anything it comes in contact with. So guess what can break down? Your oral mucosa. The powder form is used with infants and young children, but should be used cautiously because breathing them in. Inhalation of the powder may precipitate acute bronchospasms. And if mixed with food, pre-digest the food, making it unpalatable. The patient won't want to eat it. Okay. The mouth must be rinsed after enzyme administration to avoid breakdown of that oral mucosa or breastfeeding mother's nipples. I don't know why I didn't put a star next to it, because that's a famous test question as well. Let me stop for a second. Oh, great, this pen's not working. That's very important. After the patient's eaten the meal with the pancreatic enzyme, they need to make sure they wash their mouth so they don't have burning on the oral mucosa and the lips. Teach the patient to make sure they don't get it on the lips. Children with cystic fibrosis require a well-balanced, you need to know what type of diet, high protein, high calorie diet. In fact, they often require up to 150% of the recommended daily allowances to meet their needs for growth. Because the uptake of fat-soluble vitamins is decreased, remember your fat-soluble vitamins, guys, your ADEK, A-D-E-K, those are your fat-soluble vitamins. Because the uptake of fat-soluble vitamins is decreased, water-miscible forms of these vitamins are given along with multivitamins and the enzymes. When high-fat foods are eaten, the child is encouraged to add extra enzymes. Because remember, it's those enzymes that breaks down the fat. So if the patient's eating something that's really, really rich, really, really fatty than normal, they're going to need more of those enzymes. All right, what about management of the endocrine problems? Management of patients with cystic fibrosis. What does this R stand for? I hate when they do this. CFRD, cystic fibrosis, something disease. Let me go back and see if I can see what the R stands for, because I don't remember. CFRD. If anyone remembers, put it in the comment section for me. I'll come back and look, because I don't remember what they said the CFRD stands for, and it'll bother me. Oh, here we go. Cystic fibrosis. Okay, related diabetes. Cystic fibrosis related diabetes. All right. The management of cystic fibrosis related diabetes is critical, as an essential, as an important in the therapeutic treatment of the child with cystic fibrosis. Let's stop right there. Remember how I talked about how the pancreas is very important in cystic fibrosis and how it's basically rendered useless because of all those thick, tenacious mucus plugs. It's not releasing those enzymes like it's supposed to. Well, what else is the pancreas responsible for? Insulin. Making and releasing insulin. Remember the beta cells and the islets of Langerhans, and where? The pancreas. So any disorder where the pancreas is in trouble, the patient most likely is going to have what? Diabetes, because they're not going to be making enough insulin. So let's take a look. Children with cystic fibrosis related diabetes require close monitoring of blood glucose, administration of oral glucose lowering agents, or insulin injections, diet and exercise management, and quarterly hemoglobin A1C measurements. They may have to get oral anti-diabetic agents. They may have to be on insulin. Definitely diet and exercise, that's going to be monitored no matter what, and hemoglobin A1C. Every 3 months, 90 days. Remember that hemoglobin A1C gives us a 90-day reading of what that patient's blood glucose has been looking like, and how well the treatment plan has been working for that patient if they've been following it, right? Children with cystic fibrosis related diabetes should perform self-blood glucose monitoring 3 times a day and should be on insulin regimen. Why? Because that pancreas is not working the way it's supposed to. Bone health. Bone health is of concern in children and adults with cystic fibrosis. The pancreatic insufficiency of cystic fibrosis and chronic steroid use present potential risk for less than optimal bone growth in such children. So let's talk about this. All those steroids that the patient has to be on. What do we know about steroids? 3 things. Whenever we think of steroid use, there's 3 things that needs to be going to your brain, guys. 1, infection, because they mask the signs and symptoms of infection. So you have to watch the patient much more closely. 2, ulcers. Steroids are very, very hard on the stomach. They can cause gastric ulcers. And 3, osteoporosis. They can make the bones weak. And so with children whose bones are still growing, don't you think that's going to be a problem? Of course. Prognosis. The median survival age for the cystic fibrosis patient is 40 years, and approximately 50% of patients are 18 years of age and older. Wow. The median age for survival is only 40 years, guys. Lung, heart, pancreas, and liver transplants have increased survival rates among some patients with cystic fibrosis. Interprofessional care management. Assessment of the child with cystic fibrosis involves comprehensive assessment of all affected systems with special focus on the pulmonary, that's your lungs, gastrointestinal, that's your GI tract, guys, systems. Hospital care. Standard precautions with meticulous. You know what that word meticulous? That means very, very careful, very, very detailed, okay? Meticulous hand washing to decrease nosocomial spread of infection to the cystic fibrosis patient and among other hospitalized cystic fibrosis patients. These patients are at very high risk for infection. You got to be careful. Treatment, aerosol therapy, percussion, postural drainage are going to be provided while the patient's hospitalized. The nurse may at times administer aerosol therapy, perform chest percussion and postural drainage, assist with ACT such as mechanical vest, and teach the patient breathing exercises. Look at this, guys. Chest percussion and postural drainage should not be performed before or immediately after meals. Do you know how tiring that is? And with this patient who's already at risk for nutritional deficiency, when we put that plate in front of them, don't we need them to eat all their food? Okay. Planning percussion and postural drainage so it does not coincide with meals is essential to effectiveness of this treatment. It's already hard. Do you know that eating, guys, is a work within itself? If you're healthy, you don't realize it, but for patient who has breathing difficulties, it's tiresome just to eat. That takes work just for them to eat. You're gonna make sure you pay attention to the pulse ox reading, give supplemental oxygen therapy as needed. Make sure you're giving those pancreatic enzymes. ADEC vitamins, those are your fat-soluble vitamins, bronchodilators, your ACTs, postural drainage, aerosolized treatment. Make sure you're checking the blood glucose monitoring for that patient. Make sure you're giving them the insulin as ordered. And last, home care. Patients and family members need education about the preferred diet of nutritious meals with tolerated fats, increased protein and carbohydrates, and the administration of pancreatic enzymes and nutritional supplements. Remember, guys, those pancreatic enzymes, the patient needs to take them with meals and snack. Okay? Worst case scenario, within 30 minutes of the meal or snack. It's important to stress to the parents that the enzymes in the amount regulated to the child's needs should be administered, look at this, at the beginning of all meals and snacks. Not just some, every single one, every single meal and snack. For enteral feeds administered overnight, the enzymes are generally administered at the start and finish of the feeds. One of the most important aspects of educating parents for home care is teaching techniques for the removal of mucus. Again, remember how we remove the mucal, the ACT, the vest, the forced expiration, and the breathing exercises. Also, guys, we're going to teach them to watch out for signs and symptoms of infection, and they may get home IV antibiotics. That is your cystic fibrosis in a nutshell. So I had a couple comments asking me about cystic fibrosis. I guess you're taking P's right now. Well, you got your video, cystic fibrosis. Let me know in the comment section, guys, what you thought about this video, what you'd like to see me cover. If I don't already have it on my list, I will add it to my list. And thank you. When you guys comment in the comment section, it helps my algorithm. It helps my videos show up on more people's pages to support this channel. So if you appreciate the content that I'm bringing your way, I'm asking you to please support my channel. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And almost on a daily basis, you guys can watch me cover different nursing content on my other social media platforms, such as TikTok, Instagram, and Facebook. Thank you so much for watching this video, and you guys will catch me on the next video.